Should I turn off the volume?
We are live now.
Oh, okay. So we're not going to turn off the volume. You guys, it's time for another Kicking It with Carrie. I got this sign, so as promised, I'm going to be out in front of you a little bit more. And today, I've got some very exciting news to share with you. Dr. Paul is joining our practice. I was going to say Dr. Tia Paul. Your first name's a little hard for me to pronounce.
Dr. Tia Paul is perfect.
Dr. Tia Paul. So Dr. Tia Paul is joining our practice. She's already, she starts January 10th. That'll be the first day that she sees patients in the office. But she's already been around, dabbling, meeting the staff. You know, she already knows dermatology, not a subject. She's board certified dermatologist. Why don't you tell me a little bit about your background and how you came to work for us?
All right, sounds good. So I was born and raised in India. I moved to the United States when I was 18. I went to Cornell for undergrad.
Okay.
And then for medical school, I went to Harvard Medical School.
Wait. Can Harvard, like the one?
Yeah.
Okay.
Yeah, in fact, I actually went to a joint program between Harvard and MIT, so it was more research heavy. And then after that, I went to University of Miami for my residency, and I was a chief resident there as well. And then I have been practicing more than 3 years since out of residency. But now I'm just thrilled and excited to be part of Newport Beach Dermatology and Plastic Surgery.
And to be honest, we're thrilled to have you too. Like, we're so excited. One of the things I'm most excited about is that you're going to be in the Newport office, like 5 days a week.
Yeah.
And you're going to be here seeing patients a little later in the day. So that's really nice for us. So we can take like those afternoon patients, like people want to get in like after work there. So you'll be here to see those patients, which is fantastic. I want to add that there's going to, like, our link in our bio has an option to book appointments with all of our providers, and Dr. Paul is included in that list. So if you're like hearing all about her today and you're like, ooh, I want to make an appointment with Dr. Paul, you can go to the link in our bio. It'll take you to a link tree, and in that there's a, book an appointment, and you can book your appointment with Dr. Paul, whether we're open or closed, weekends, evenings, mornings. I mean, you can make the appointment after hours for during hours times.
Yeah.
So anyway,
Okay.
So Dr. Paul, tell me about like your areas of specialty. What really gets you excited about dermatology?
So the best thing about dermatology is that I get to see patients that are little ones, like literally from newborn, so pediatric patients, as well as adults. I think my oldest patient is like 102 years old. And I like to do a wide range of medical, surgical, as well as cosmetic dermatology. For medical dermatology, I love to take care of my patients with acne, hyperpigmentation, eczema, psoriasis. I do use biologic treatment to treat eczema as well as psoriasis. And then I also do believe in skin cancer screening and treatment of skin cancers. So that's one thing that I do see a lot of patients for full body skin checks, again, all ages. And then aside from that, I also do like to do cosmetic procedures. So whether it's neurotoxins like Botox, or even laser treatment for hyperpigmentation, redness on the cheeks, or even acne scar, and chemical peels. That's probably one of my favorite ways to treat people. And given that I'm from South Asia, one of my areas of interest is also skin of color, particularly brown skin and among South Asians as well, because I'm pretty comfortable with how any procedure or even any treatment can look much different on brown skin or skin of color. So I'm here to kind of take care of my patients for all of that.
I know that in particular is a very special skill, because some people are very nervous to treat skin of color because it can have adverse reactions effects. So you're very comfortable in that area. That's fantastic.
Yeah.
And then in particular, of course, Harvard trained, Cornell, all that. You've got a pretty impressive resume. Why did you want to come work with us?
So the question is, why not?
Okay.
Because, the thing that gets me really excited about Newport Beach Dermatology is the fact that we have all the coolest devices, and it's like almost feeling like a kid in a candy shop. The dermatologist in this great practice, but we have all the newest tools. So the newest Botox, for example, that came out is called Daxify, and there's very, very few places in the country that have access to it, and I'm already trained in that. I haven't even started.
Yeah.
So and then there are newer devices for acne that's FDA approved, which is called Aviclair, and I believe our practice has it already.
Yeah, we do, and very few offices have that.
Very few offices have all these. Ellacor, which is all over. It was the buzzword for this meeting that we went to San Diego recently. and we already have that. So the fact that we have access to all these amazing tools and being able to take care of our patients just in a very wide way.
I really like that you brought up those two tools in particular because they are very new to our practice and also very uncommon to find at other offices in and around Newport Beach. So you mentioned Aviclear, which is an acne treatment. As many of you know, acne is often first tackled with an antibiotic. Some people don't like to use antibiotics, so it's great that we have this treatment that allows you to be treated and get successfully treated without the use of medications. That's one. And then the Elicor is another one that is new for our practice too. We've probably had it, I'm going to say for about 6 weeks, maybe a month. I know I got treated with it October 31st. The idea is that it pulls micropores out of your skin and it helps to tighten any excess skin. And you can hope to achieve 5 to 10% improvement each treatment you have. And they usually recommend a series of 3 treatments. So Dr. Paul will definitely be trained and be using the Elicor as well as the Aviclear and all the rest of our, modalities that we have in the office.
Yeah.
Yes. And I wanted to add, while I've got you here, we're lucky to have you because you're kind of a big deal already on the gram and the talk. So tell me a little bit about your experience with Instagram and TikTok and where our patients might be able to find you if they were interested in checking that out.
Yeah, so I really believe in education. That's so important. And social media nowadays, it's a great source for everyone to get their information. But sometimes you just have to be careful about the source of your information. And I personally do believe that it's important to have physicians as well as dermatologists talking about skincare or there are a lot of myths that go around and just like clarifying the right and the wrong. So I am active on my Instagram, which is DRSPaulDerm, as well as on TikTok where I have a little bit of a larger following, and that's DRPaulDerm. But I talk a lot about day-to-day, skincare solutions and talk about basics of acne, hyperpigmentation. And the other thing is I do love working with skincare companies as an expert dermatologist, so you will hear me do some interviews and things like that over there as well.
That's so cool because with my Kicking It with Carrie, I kind of think we're like the bomb, but in actuality, I have a lot to learn, and so we might be doing some more fun things with Dr. Paul, and I really look forward to that. I look forward to having you here join us in our practice, like I said, beginning January 10th, and your schedule's going to be, it's Monday through Friday, and then
Tuesdays through Fridays,
and then you're going to be working
so it's going to be Tuesday and Thursdays from noon to 5, and then Wednesdays and Fridays from 9 to 5.
Awesome. Super excited to have you. Thank you for joining me today. I know that it's a really busy time and you want to be with your family, which I'll just touch on that real quick. You got some little boo-boos at home?
Yeah, I have a 5-month-old son and a 4-year-old daughter.
Oh my goodness.
Yeah.
4-year-old, that's got to be the most fun this time of year.
Yeah. And she's a great big sister. So she's the one who helps out with the little one. But yeah, for Santa, we have to, prep a little extra and make sure she also feels like a little one.
So much fun. Well, I certainly hope you have a wonderful holiday with your family. Mm-hmm. And for all of you that are joining us today, thank you so much. And I want to wish you all a very happy holiday with your families and your loved ones. And we're so happy to have you as patients and grateful that you come into our practice and support us. Thank you. Bye-bye.
Take care.